there, Ruth again from ARC Seminars. I want to thank you for your continued interest in our webinar, Cancer Care, a Collaborative Approach. During this video, I want to highlight a few things that you are going to take away from the webinar and bring right back into your practice about how cancer diagnosis, treatment, and the after effects of everything can really have an impact on the patient's function and quality of life. So some of those aspects that you are going to see in your practice and with your patients are the fact that they have pain pretty frequently. So patients with cancer before the diagnosis, throughout their treatment, as the disease progresses, and also even after they've had a treatment course that has been curative, they're going to have this lingering pain that is going to nag at them and really affect their quality of life at times. So this is a huge aspect that therapy can help on. Physicians can help, nurses can help, all aspects of the healthcare team if we're aware that this is happening and that it is an impact in their life. Another thing is fatigue. So you're often going to see your patients being fatigued, not only from just the emotional and social impact and all the stress, but the treatments themselves do wipe the patients out pretty often. So chemo, radiation, and things like that are very fatiguing for the person. So you want to make sure that you are providing the appropriate exercise prescription to the person and that you're not, for lack of better phrase, not taking it too easy on them just because they're tired. You still want to provide an appropriate amount of exercise and activity so that you can help that person progress and stay functional. They also might experience something called chemo-induced polyneuropathy. So now they're in pain, they're tired, and now they're going to possibly have decreased sensation, decreased proprioception, which will put them at a higher risk for falls and skin breakdown and things like that. So you want to be aware of the fact that this can happen, and it may be happening with your person, and provide education and different strategies to compensate for the things that are going on. Somebody might also experience pelvic floor dysfunction, depending on what type of cancer they're experiencing and if they've had to have any surgeries or any type of radiation or anything that would compromise the pelvic floor. They could then start having pain, they could have incontinence and things like that, therapists, nurses, physicians, we can all come together and really help this person overcome all of the impairments that they're having because of the pelvic floor dysfunction. Lymphedema is often found as well after, particularly after a mastectomy, where they might be removing lymph nodes in addition to the breast material that was cancerous. So this could leave the person with a swollen limb. And that has a huge impact on a person's ability to function normally. So this is something that is very well addressed by therapists. So just keep that in mind. They could also start to have shoulder dysfunction and different other orthopedic impairments as well. So speech language pathologist is also very much indicated in a lot of patients with cancer who have what we call chemo brain. So the chemotherapy is trying to get rid of those cancer cells, trying to help the patient recover, but it can also have an effect on the brain and on cognition. So this is where we would want to be in tune with what our person's prior level of function is, and then where they're at now, what kind of treatments they're on, and then we could refer them on to the appropriate professionals. So that's just a little snapshot of what you might take away from the course that would be very, practical and usable, and more to come on that. And I will certainly put a link to the webinar itself in the notes below the video, and stay tuned for more.